Hey, everybody. All right. Well, so welcome to the weekly Tuesday live video series. I am Dr. Dana Gibbs. It's so nice to see you. And today, my topic for the day is some common symptoms that are really telltale for hypothyroidism. So I named the thing focus struggles. Is this brain fog normal, or is it hypothyroidism? Because so many people have this symptom and they don't realize that it has anything to do with thyroid. So let's get started. All right. And I actually have some really exciting news. So I have a start date for the fall run of the new endocrinology lecture series for physicians. Y'all have already attended this, or some of the sessions know how amazing this is and how it's going to be. And it's not for endocrinologists. It's not just for endocrinologists anyway. We have primary care, rheumatologists, GYNs, ENTs, even psychiatrists participating and now using these techniques daily in their practice. So we discussed some new ideas in the topics of thyroid, adrenal management, menopause, men's hormone health, and a lot more. And we discuss the integrative techniques, some supplements, and other things besides your standard dogma treatment. And so, everything's evidence based, though. And this is an amazing opportunity to dive deep with an extremely skilled and experienced mentor physician of mine who's been using integrative endocrinology in his practice for about 30 years. So he feels like it's his dharma to pass this knowledge on to any physician who will use it to help patients. So we meet live on Sundays at 7 p.m. Eastern. Um, there will be a paid option with replay access, but attendance at these live sessions is available at no cost as long as you register. This is really an amazing offer because this course has been given at in-person conferences for over $1,900. And if there is enough interest, I'll be able to get CME for the participants, category 1, AMA, PRA, CME. So if you are at all interested, please use the link below to get more details. And that is www.algaeaccessmd.com/endo-opt-in. I hope to see you there, and we will be sending out by email more information. Kind of depends whether we can get the CME. It kind of depends on how many people sign up. All right, on to today's topic. So if you are listening to this and you are not a physician, please keep in mind scientific proof is not nearly as black and white as people think. And in order to make treatment decisions for individual people, sometimes we have to consider evidence that's not nearly as absolute as we'd like. So this is not meant to be individual medical advice. You should consult your own physician for any medical issues or diagnosis you may have. So when a patient comes to see me, there are specific signs and symptoms that I'm looking for that make my antenna twitch that thyroid could be playing a role for them. And that happens even if I am in an ENT clinic seeing ENT patients. And for a lot of these patients, I'll ask them, "Oh, have you had your thyroid checked?" And they'll say, "Oh, no, I tested normal." But most of the time, there are enough signals to me that lead me to think, you know what, we should check again and dig deeper. So I'm going to just go over some of the more common of these signs and symptoms. So hair is kind of the first one. So when a patient is sitting in front of me and I'm looking at them, I'm looking at their face and I'm looking at their hair. And a lot of times I will see men and women who have lost a substantial portion of the outer part of their eyebrow hair. And that really is just a dead on trigger for me. This person probably has thyroid problems. The other thing is for women, if you have thinning or loss of the hair on the top of the head to the point where you can look and see through to the scalp, a lot of times that is really, really telltale for hypothyroidism. So the other thing about hair is that it can be dry and brittle. It breaks really easy. Um, some other ones are dry skin and itchy skin. So a lot of hypothyroid patients will have dry, itchy skin. A lot of them will have a little bit of nodular thyroid, meaning when you feel the thyroid gland, and it's not up here, it's down here. When you feel the thyroid gland, instead of just feeling the ridges of your windpipe, you feel a thickness that's lumpy over that. And if you have that, then you have something going on in your thyroid, and a sonogram is necessary. Next thing is neck swelling. So if you have swollen neck where it's actually sticking out right here at the bottom half of your neck, that's also pretty telltale that something's going on. Here's some other ones. A puffy, swollen tongue. So when you open your mouth, if your tongue sticks up above your teeth to the point that you can't see your uvula, the dangly part of the back of your throat, that's a pretty common issue with thyroid patients. And generally will also have little ridges in the side of your tongue where your teeth are squishing in on your tongue because it's gotten too big for your mouth. And then if you have that, it's also going to make you snore or maybe even have sleep apnea. Okay, here's another one. Fatigue or sleepiness after you've already slept for at least 8 hours a night. And that's not just one night, that's over and over and over again. All right, next one, mood swings, anxiety or depression that is not responding to normal treatments or not related to anything that you can pinpoint, or has gotten worse with no good reason. Okay, next one, muscle aches or joint pains without reasonable explanations. Um, and then really, really common, cold hands and feet, or feeling cold when other people are not, or having your body temperature consistently be below 98.6 degrees. And I'm talking like 97, 96.9. I see that very, very frequently. And then everybody knows weight gain. So the inability to lose weight, even with a really aggressive diet, sometimes is associated. I mean, there's lots of reasons to have that problem, but sometimes when we dig, we will find that a person has a subtle or maybe a not so subtle thyroid abnormality on their blood tests. And then finally, last couple here, constipation. So if you're not effortlessly having a regular bowel movement without drinking a big cup of coffee each morning or something like that, constipation can be a sign that you have low thyroid issue. And then the very last one, which is why I call this focus struggles today, is mind issues such as brain fog or slowed down thinking or poor ability to concentrate or poor memory. And this one is so insidious that sometimes and sometimes it's the only thing wrong, and frequently it is not recognized by the patient even when they are flagrantly low on thyroid, until after they start the treatment and they're like, "Oh, I've been living in a fog." So here's the problem with thyroid symptoms. So each one taken individually, they're pretty vague symptoms. They have a lot of different possible explanations. And taken together, several of them at a time, or symptoms without other suggestive medical diagnoses, get to be red flags of hypothyroidism or other hormone related issues, which actually a lot of those go together. You know, like if you have low thyroid, you may also have menstrual problems. If you have low thyroid, you may also have low aldosterone, low blood pressure, some other things. But anyway, interestingly, so many of these symptoms are also seen at the onset of the early part of perimenopause and menopause. That is a topic for another day. And next week, I want to go over some much less common, but still serious issues that happen with low thyroid. So that's it for now. I'm Dr. Dana Gibbs. I'm an integrative physician here in North Texas, where I help people address their thyroid and other hormone imbalances. You can sign up for my newsletter at www.danagibbsmd to get valuable tips and notifications each time I do another one of these lives, or to sign up for a new patient appointment. Finally, don't forget about the physician's course that's coming up. And if you have any thought at all that might be interesting for you, check out www.allergyaccessmd.com/endo-opt-in. And it is going to be amazing. And we're starting on September 24th. Okay, guys, that's it for now. I'll talk to you again soon. Bye-bye.